Hello, today I'm going to talk about the importance of psychological assessment in children with special needs. I'm a clinical psychologist and a lecturer. I'm going to share with you my experience of handling psychological assessment in children with special needs. So before we begin, let us all define what is psychological assessment first. Some of you may know what is it, some of you may not know. Some parents come to us and ask us what exactly it is. Does it look like this? Does it even look like this? Whereby there's a device there is actually stuck at the head of the child, and then we can understand the brain wave and the activities that is going on in the child, so that then it's a psychological assessment. Many times we tell them that it's not any like this, it is actually something like this, whereby the psychologist would sit and give the child some questions and some activities to do, and the child needs to respond to them. And this is something like a psychological assessment. So, psychological assessment involves an objective manner in which one psychological functioning is assessed. I would like to focus on being objective here when we do psychological assessment. Objectivity is very important because when objectivity is there, we're able to test the person's responses in a much more standardized manner, and therefore we can compare the responses to the normative group, and we can confirm whether the child has any deficit or not. So using this kind of standardized measure would allow us to come to a conclusion whether the responses given are actually according to the milestone and according to the developmental age of the child. And typically these normative groups are based on the person's age, such as if the child is 7 years 9 months, we are going to compare the responses with a 7 years 9 months response. Basically, psychological functioning is what psychological assessment measures. Psychological functioning is defined as a broad label since many different abilities are assumed within this. More specifically, when people refer to psychological functioning, it helps them to understand if they are referring to intellectual abilities and some other cognitive skills such as attention, emotional functioning, and or personality characteristics. So I've given a slide here to fully understand what psychological functioning would include. Typically, when we actually assess a child, we need to understand in different domains. So the first domain is the physical domain, second domain is emotional domain, third domain is cognitive domain, and the last one is social domain. So physical domain is not assessed by a psychologist, it's normally assessed by medical doctors, such as indicating that whether they have growth issue, whether they have some physical disabilities, whether they have some physical illness, and so on. While for psychologists, normally they will focus on these three main areas, which is emotional functioning, cognitive functioning, and social development. So emotional functioning is more to how well they can express their emotion and how well they can cope with a certain issues, and basically they're expressing their emotion in an appropriate manner. The cognitive functioning is actually about their IQ, the intellectual quotient, whereby we will understand how well their brain is actually developing. And then we have social development, whereby we will understand whether the child's social relationships, social communication, and socialization with their peers is actually appropriate. Not only with their peers, but also with the people around them. So how do we assess all this sort of like kind of like abstract kind of construct? We use tools, we use psychological tools. So one of the very popular tools is actually the cognitive tool, and this is one of them, the Wechsler. So in the Wechsler cognitive tool, we will administer some blocks, some questions, some images and pictures to stimulate some kind of responses. And then given the responses, we will accumulate the scores, and then we will compare it with the responses given by the same age group, and then we will determine which level they fall into. And then the second type of very popular assessment is actually paper and pencil response, and it's called the questionnaire. So this questionnaire can be given to the child if the child is able to answer themselves, such as if the child is an adolescent already, they're able to self-report their emotions, then we will give the questionnaire to the child. But if it's a younger child, typically we will give this questionnaire to the parent so that the parent can actually answer and indicate what are the issues that the child is facing, and then we can actually determine how well the child is actually functioning. Another type of assessment is actually interviewing the caregiver, parents, or people that are close to the child. So the psychologists would ask a lot of questions pertaining to their background, family history, educational history, and even their socialization history and so on, in order for them to understand fully how the child is doing. Because the child is not able to tell in the session itself, it is important for the psychologist to ask these questions to the parent in order to obtain this information. And more importantly, the parents is also able to cooperatively give the information in a more holistic manner. And then the last type of assessment that are typically used by psychologists is actually play. Through play with children, we are able to understand the behavioral functioning of the child. And through play, we are able to elicit a lot of different types of functioning, such as eye contact, social relatedness, languages, and cooperativeness, behavior, and so on. So sometimes some psychologists do use play to understand how well the child is doing, and therefore we can understand the holistic manner of the child based on all these different types of tools, all these different type of tools and methods. So what is included in psychological assessments? There are many different types of evaluation that can be pursued, and the main thing is it depends on what is the purpose of the testing. The more typical and more widely used among children with special needs is the psychoeducational evaluation, because children with special needs unfortunately may have some difficulties with learning. So therefore, psychological evaluation is the more commonly used evaluation. So often this testing centers around intellectual testing and academic testing, such as involving tasks such as math, reading, and written language. Comparisons are then made between one's intellectual abilities and his or her academic skills. Now, if there is a differences between the person's intellectual skills and the academic skills in a particular area, probably there is some sort of issue with the learning itself. And therefore, we can somehow provide a basis to understand that maybe the child has specific learning disorder. Psychoeducational evaluations are often performed within schools. But I know that in Malaysia, it's quite limited for us to do psychoeducational evaluations in schools itself. These evaluations are often done privately, however. So many a times, parents come to us as a third party in the external setting to do the evaluation. And normally, these external settings are qualified psychologists. So many of these measures, such as classroom observations of parents and teachers' questionnaires or observation of behaviors or emotional functioning, may be included in this evaluation as well. Even though the presenting problem, the problem that comes when the assessment was done, is related to cognitive only. But in order for us to understand the child in a holistic manner, normally they will assess even the emotional functioning and some other issues that may be present. Though school psychologists cannot diagnose specific disorder, such as ADHD, what is very important is that it's not about the diagnosis. It's about guiding and intervention. The results of the assessment helps the person who developed the IEP, the Individualized Education Plan, to improve on the plan, to improve on the accommodation for the child, and to start with the level of the child that the child is actually functioning at. So many a time psychoeducational evaluations does not focus on diagnosis. They focus on developing a treatment plan for the child in order to help the child to improve. Now, who can actually conduct the psychological assessment for children with special needs? In Malaysia, typically, we have different professions that can do psychological assessment, and they are psychologists. So the first type is actually clinical psychologists, whereby they can do assessment and make a diagnosis. Counseling psychologists, educational psychologists, they can do assessments but cannot make a diagnosis. Neuropsychologists I've indicated here, but it's in another color because they can do psychological assessment, but normally they do not do assessment for children with special needs per se, but they do know how to do psychological assessments. And the minimum qualifications for these specialties are actually master's qualification from the field of clinical counseling or educational psychology, or basically any field that they claim they are in. So make sure that you check their qualification before allowing your child to do any assessments with them. Why do we do psychological assessments? We need to help the child to understand emotional, cognition, and personality functioning at a very short period of time. Because if we want to understand the child's emotion, cognition, and personality functioning, we can through various methods, through many different types of assessments with the teacher, with different people to understand the child as a whole. But this testing itself, we're able to understand them in a more comprehensive manner in a short period of time. So that is very important when time is actually tight. We want to develop individualized plans for them immediately so that we can help them at a very young age. Results from these measures can help with recommendations for mental health treatment, such as the use of medication or therapy. And these strategies can be very helpful to teach the client. Findings can also help guide other referrals, such as referring them to specialists like psychiatrists or neurologists. Depending on the age of the child, some measures may include questionnaires that are only completed by the child themselves. Yeah. So, for example, some questionnaires that the child can actually do themselves, like adolescents already, they can actually respond to the questionnaires. Then we allow them to do that. When assessing a child, parents often complete questionnaires that ask what they observe behaviorally and emotionally in the child, because we want to assume that the parent actually knows best of the child. So whatever the child is going through, then the parents will need to understand and report on behalf of the child. However, if the child is actually adolescent already, it's more common to obtain the emotional and personality questionnaires from the adolescent themselves, because they can now report their own emotions and personality and behavior themselves. So many times, parents and primary caregivers would still report a little bit, but we don't rely solely on these measures. We also want to see how the child is actually thinking and feeling and so on. Parents or caregivers' responses are particularly helpful because sometimes some children may still not be able to have enough insight or awareness into their problems, so they may overlook some of the issues themselves. And therefore, the information given to the psychologist may not be so accurate. These evaluations are conducted normally in clinical settings in which obtaining such information is necessary to guide a clinician's diagnostic impression and develop treatment recommendations. So another type of psychological assessment is neuropsychological evaluation that could help to measure more detailed aspects of cognitive functioning, such as executive functioning ability. What is executive functioning ability? It is a major part of the brain whereby it helps to plan, organize, inhibit cognitive, emotional, and behavioral responses, attention, learning, memory, and even motor coordination and or strengths. Oftentimes, referral may come from physicians or therapists who are concerned about a client's or patient functioning in this area, whether it can be related to neurological conditions such as seizure disorder, head injury, or dementia, or to a psychiatric disorder in which it's common for mood states or anxiety to negatively affect one's cognitive functioning. So, most of the time when there's a need to do neuropsychological evaluation, it's normally referred by some other mental health or some other health professionals, because they think that there could be some neurological conditions that impact on the child or impact on the client themselves. So this psychological assessment will help to provide more detailed aspects of their cognitive functioning rather than just suspecting. And these cognitive functionings are very important cognitive functioning, which is called the executive functioning, whereby they includes attention, learning, memory, and so on. Neuropsychological assessments are often conducted in the medical-based setting. When this is the case, a neuropsychological assessment battery can capture one's functioning more globally with measures of intellectual, academic achievement, neurocognitive abilities, personality, and emotional functioning. So basically, this is a battery whereby they will assess different areas, and therefore we can get a glimpse of how the person actually functions in a more holistic manner because they really access on all the different domains. While testing is often sought after to diagnose a condition or to understand one's possible difficulties in any areas of functioning, it's also important to learn what someone's strengths are, right? So, psychological assessment can also provide us with understanding the strengths and weaknesses of the persons. And it's important and helpful to inform individuals from testing of what their strengths are and how to use this to compensate for any documented weaknesses they have. Information helps empower people to develop and grow, and results obtained from psychological assessment can help people be more informed as to how to proceed with utilizing their cognitive and emotional strength to help improve their mental health overall. So basically, in summary, in order for us to understand a person, we don't only understand on the weakness. We don't focus on the weakness to help us to understand the person and help them to improve. We also need to understand their strengths, and we utilize the strengths to help them to improve and basically empower them to develop and grow. Special needs children are children who have disabilities, health or mental health conditions requiring early interventions and support. So, psychological assessments provide an important contribution to understand, explain, predict, control, and solve problems of children with special needs. So, psychologists apply psychology theories in understanding explanation, prediction, control, and solve problems. Through the assessments, the results can help us to use and to predict, to understand, to explain what is going on with the child. Theories are very important tool for psychologists to understand and explain conditions like this, especially children with special needs. So these theories in psychology can be seen as a starting point for making predictions and intervention based on the results from the psychological assessments. This is a case example that I'd like to share before we finish the entire presentation. 11-year-old boy brought in with complaint of oppositional defiant disorder symptoms, whereby there's a lot of complaints from school indicating that he's very defiant and doesn't follow rules. So he was brought in by his uncle, and his uncle reported that he frequently ran out of class, draws on the classroom's table, and does not listen to his teachers. And sometimes he will also hit his friends. And when we want to understand further what the child is going through, we interview the uncle, and even we call up the parent to ask. Actually, he lives with his uncle while his parents works in another country. He only gets to see his parents once in 6 months' time. He does not share his emotions with his uncle, and most of the time, his uncle would just ask if he has finished his homework. That's it. So his results were not very good since young, and teachers had been helping him, but he has not been improving. He does not have much friends in school. So in order for us to understand this child, we need to do a psychological assessment because there's so many complex information that are given to the psychologists. So we did an emotional, cognitive, and educational assessment. And the outcome was that the child may have learning disabilities. Basically, the child tries very hard to learn, and there is not much support from the family. And the child struggles so much and yet still being bullied by the friends. That's why he was behaving in a very naughty manner. So the child is struggling and struggling, but yet nobody understands the child. And finally, once we made the diagnosis, he was sent to appropriate intervention, and from then on, he can learn better. So this is how important psychological assessment is. Sometimes information given to us, it's quite in a surface kind of condition, and we may not know what is truly the child going through. By doing this psychological assessment, we can fully understand what the child is going through, and from there we can help the child better. So that's all for my presentation, and these are the references that I use for my presentations. Thank you.